everyone, my name is Catherine Bauma, and I'm a fellow member of your P1 class this year. And I made this little video presentation about the top 50 drugs, kind of the first tier of information we're supposed to know about everything, including the generic and trade names, therapeutic class, and DEA controlled substances. And I'll kind of explain things as I'm going along, at least from the experience that I've had as a technician at Lewis for the last 2 years. Had a lot of different experiences, so I thought I'd share some of that information with you, kind of as I'm going through everything. Basically, the main reason I made this recording was so that I could listen to it as I'm driving back and forth from Sioux Falls every day. And I thought, maybe it would help you guys out too to listen to the drug names, learn pronunciations. Now, I know some of you have also had experience as a technician or in a pharmacy setting. So if I do pronounce something differently than you, that's fine. Whatever way that you're going to remember something the best is what's going to, obviously be best for you. And I'm open to any suggestions in further recordings. If you're wanting additional information on anything, just please feel free to ask. I'm also considering making another video kind of just to help you remember the names and stuff a little bit better. I kind of have like a fun and funky way to remember things. I usually try to think of something silly or that will just like stand out in my mind, I guess, as to help me remember everything. So I can definitely make something like that if you're interested. Just comment or like or whatever on this video, and I'll definitely help you out with that. Yeah, so I guess we'll just get started with everything. So the first drug, as you know, is levothyroxine sodium. Brand names are Synthroid, Levoxyl, and Levothyroid. It's a therapeutic class. It's hormone thyroid. It is not a controlled substance, so it doesn't have a DEA schedule. Next drug is hydrocodone bitartrate with acetaminophen. Brand names are Lortab, Vicodin, Norco, and Lorcet. Therapeutic class is an opioid analgesic, so it's going to help control pain. It's a DEA controlled schedule number 2 substance. So let me just explain a little bit about the DEA schedules. In South Dakota, there are only schedules 1 through 4. And of course, schedule 1s are not going to be dispensed in the pharmacy. Those are going to be drugs like heroin and cocaine, so we don't want to go anywhere near those. DEA Schedule 2 are very usually readily available, but what's going to happen with those versus like Schedules 3 and 4, etc., these are just like a little bit more regulated. So in a pharmacy setting right now, for a prescription like this, we would require a hard copy prescription, either mailed to us from the doctor's office directly, or the patient would have to drop it off. So a doctor's office cannot call or fax this one in to the pharmacy. So it's just a little bit more tightly regulated than some of the other schedules we'll see later on. So that's kind of the difference there. Lisinopril. Name brands are Prinavil and Zestril. Therapeutic class, it's an antihypertensive, so this is going to help control blood pressure. It is not a controlled substance, so no DEA schedule. Omeprazole. Brand name is Prilosec. Therapeutic class, it's a gastric antisecretory. So what that means is it's going to help with acid reflux. It is not a controlled substance, and it is available OTC, which means you do not need a prescription for this medication. However, for some people this might be beneficial to get as a prescription, and many people do, because their insurance will help pay for a prescription versus over-the-counter. Insurance does not help pay for over-the-counter medications. I just thought I'd include that as kind of an extra point, so you can know that. Amlodipine benzoate. Now, if you're wondering what the second word is in the drug name like this is actually the salt form of the medication. And so with that salt, it's going to help your body to absorb the drug much better than if it was just the drug by itself. Just in case you were curious about that. Brand name is Norvasc. Therapeutic class, again, it's an antihypertensive, so it's going to help with that blood pressure. And it is not a controlled substance. Simvastatin. Brand name is Zocor. It's an antihyperlipidemic, which is a really crazy way of saying it helps control cholesterol. And kind of a giveaway on any of these medications that might be the antihyperlipidemic is that statin ending. I don't know if you've ever heard of statin drugs. That's kind of what they're referred to as a class altogether. So if you just pay attention to a lot of the drug endings, that'll give away what it's used for. And this is also not a controlled substance. Metformin hydrochloride. Brand names are Glucophage or Glucophage XR, Glumetza or Riomet. That XR just means extended release, in case you're wondering. It's an anti-diabetic medication, so controls diabetes. It is not a controlled substance. Furosemide. Name brand is Lasix. It's a diuretic, so it's going to control your fluid levels. It is not a controlled substance. Albuterol sulfate inhalation. Brand names are Proventil HFA, Ventolin HFA, and ProAir HFA. These are all going to be inhalers. They are rescue inhalers, and they're short-acting, in case you're wondering. They're anti-asthmatic, as far as therapeutic class, and they are not a controlled substance. Gabapentin. Brand names are Neurontin or Grolis. Therapeutic class, it's an anticonvulsant or antineuralgic. So these help. This drug will help you control nerve pain. Is like the main usage. I've also seen it used somewhat for opioid dependence. So if someone has been addicted to an opioid prescription in the past, the doctor may prescribe gabapentin to help alleviate that. At least I've seen that used in the past in my experience. It is not a controlled substance though. However, I think some people do sometimes abuse this prescription, so I wonder if that will change in the future, but I don't know. Atorvastatin calcium. Again, notice the ending there. It's a statin drug. Brand name is Lipitor. Therapeutic class, again, antihyperlipidemic, so it controls the cholesterol. Not a controlled substance. Hydrochlorothiazide. Brand name is Microzide. Therapeutic class, it's a diuretic, so again, controls the fluids. Not a controlled substance. Alprazolam. Now, I don't know if you've been paying attention, but by some of these names here, I've put different stars or asterisks, and that just kind of denotes the DEA controlled substance, so it stands out very clearly as to which ones are controlled substances. Brand name is Xanax or Xanax XR. Therapeutic class, it's an anti-anxiety agent, and it's a DEA Schedule 4 controlled substance. So for this lower level of DEA schedule, we currently in South Dakota, the law does not, well, it's just changing, I guess, that we will soon be able to accept electronic prescriptions, but in the past, the main thing is that we did not accept those electronic prescriptions sent. So we could accept this via fax or from a phone call, or of course a hard copy prescription, so the actual piece of paper someone might drop off. So this is just kind of currently changing in South Dakota. Metoprolol tartrate. Brand name is Lopressor. It's an antihypertensive, so again, helps with that blood pressure. It's also a beta blocker. When you see that OL ending, that's kind of a giveaway that it is used as a beta blocker, so it can be used for those arrhythmia issues as well. It's not a controlled substance. Citalopram hydrobromide. Name brand is Celexa. Therapeutic class is an antidepressant. It is not a controlled substance. Metoprolol succinate. Brand name is Toprol XL. It's an antihypertensive, also beta blocker again. Not a controlled substance. Tramadol hydrochloride, I put the 4 asterisks there so you know right away that it is a controlled substance. Brand name is Ultram or Ultram ER. Again, ER just stands for extended release. Therapeutic class is an analgesic, so it's used for pain. It is a DEA Schedule 4 controlled substance, and this recently kind of changed over from a non-controlled to a controlled substance because it has those opioid-like properties. Azithromycin dihydrate. Brand names are Zithromax or Z-Max, or often you'll hear this referred to as a Z-Pack because it often comes in a pack-like a form that you can just use. It's kind of like an easier to use deal when they're in the pack. Therapeutic class is a macrolide antibiotic, and you'll become more familiar with these different classes of actual antibiotics. I know you're all probably familiar with antibiotics, but there's at least 6 different main classes, and macrolide is one of those 6 main classes. It is not a controlled substance. Losartan potassium, brand name is Cozar. Therapeutic class is an antihypertensive, so again it helps with blood pressure. It is not a controlled substance. Amoxicillin trihydrate, brand names are Amoxil, Moxitog, or Trimox. Therapeutic class is an antibiotic. It's not a controlled substance. And it has similarities in properties like penicillin. So if someone has a penicillin allergy, they're probably not going to be able to use amoxicillin either because it has that beta-lactam group in the chemical structure. That's why all of them have that ending, that cillin ending, is because they have that beta-lactam ring, which a lot of people have allergies or resistance to that. Like a lot of bacteria are resistant to penicillins anymore. Montelukast sodium, brand name is Singulair. It's an anti-asthmatic or anti-allergy. It is not a controlled substance. Ibuprofen, you're probably all familiar with this one. Brand name is Motrin. It's a non-steroidal anti-inflammatory, or NSAID. I'm sure you've all heard that terminology before, a non-steroidal anti-inflammatory drug. One thing you'll really want to pay attention with this is that so that patients will not combine multi-NSAIDs together because it's very dangerous. It is not a controlled substance though, and some strengths are available over the counter. However, some strengths are only available via prescription. Prednisone, brand name is Deltazone. It's an anti-inflammatory. I often think of it as a steroid, so I kind of added that in there. It is not a controlled substance. Sertraline hydrochloride, brand name is Zoloft. It's an antidepressant. It is not a controlled substance. Clonazepam, again, notice the asterisks there. Brand name is Klonopin. It's an anti-epileptic. I've also seen it used for anxiety issues. So when it says anti-epileptic, that just means it helps with seizures as well. It is a controlled substance, so it's Schedule 4. Trazodone hydrochloride. Name brands are Desiril and Oleptro. It's an antidepressant. It is not a controlled substance. Fluticasone propionate nasal. Brand name is Flonase. Maybe you have heard of that one. It's pretty popular. It's an anti-allergy agent. It's not a controlled substance, and it is available over the counter as of like 6 months ago. So you do not necessarily need a prescription to get this. However, it can be beneficial to get a prescription if your insurance covers it. Pravastatin sodium. And notice that ending again. That gives it away. Name brand is Pravachol. It's an antihyperlipidemic, so there you go. Helps control that cholesterol. It is not a controlled substance. Meloxicam. Brand name is Mobic. It's a non-steroidal anti-inflammatory, so again, it's that NSAID. It's not a controlled substance. And this drug is actually very similar to ibuprofen in the way that it works. Lisinopril with hydrochlorothiazide. Brand names are Zesteretic and Prinazide. It's an antihypertensive. It just has a little bit of that hydrochlorothiazide mixed in there to help control those fluid levels as well. It is not a controlled substance. And this is a very beneficial prescription. Instead of someone needing a prescription for both just the lisinopril and the hydrochlorothiazide, it combines them together so that the patient doesn't have to necessarily take multiple drugs. They can just have it all in one, so it's very convenient. Warfarin sodium. Name brands are Coumadin and Gentamine. It's an anticoagulant, and you'll hear that phrase a lot as you're going throughout pharmacy school, especially if you have a hospital rotation in anticoagulation management. This is a very specific area of pharmacy and very focused on different lab values for blood levels, blood clotting in particular. So you'll see that a lot as you go throughout your pharmacy experiences. It is not a controlled substance. Clopidogrel bisulfate. Brand name is Plavix. It's a hematological agent, and I wrote in parentheses here it's an antiplatelet, so it really helps to fight those artery clogging issues. So it can kind of help with blood pressure too. It is not a controlled substance. Pantoprazole sodium. Again, here's another common ending, that OLE. Same like the omeprazole, the pantoprazole has that same ending, so that kind of gives it away. So just kind of pay attention to little clues like that as you're going throughout these drug cards. Name brand is Protonix gastric anti-secretory. So again, it helps with that acid reflux. Not a controlled substance. Potassium chloride, the oral form. Name brands are Chlorcon, K-Dur, Micro K. So notice how they all have K in the name. So potassium, you look at the chemical chart. You know it's a K. So just notice that. Therapeutic class, it's electrolyte. Not a controlled substance. Carvedilol. Again, that OL ending that kind of gives it away. Coreg and Coreg CR are the brand names. It's an antihypertensive, so again, pay attention to that. It also can be used as that beta blocker. Not a controlled substance. Zolpidem tartrate, again, I included the asterisks there. Brand names are Ambien, Ambien CR, that just means controlled release, and Intermezzo. It's a sedative, so it helps you sleep. Get some Z's. So Zolpidem helps you get some Z's. It's DEA Schedule 4 controlled substance. Fluoxetine hydrochloride. Brand names are Prozac and Serafen. It's an antidepressant. It is not a controlled substance. Cyclobenzaprine hydrochloride. Brand names are Amrix, Flexeril, and Feximid. I think I forgot to include that X there, so sorry about that. Therapeutic class, muscle relaxant. It is not a controlled substance. Atenolol. I wonder what that OL ending means. Brand name is Tenormin. Aha, it's an antihypertensive, also used for a beta blocker. Not a controlled substance. Tamsulosin hydrochloride. Brand name is Flomax. And that just kind of helps you to remember what this drug is for. It's prostate anti-inflammatory. I've also seen it used a few times in women for bladder health. It is not a controlled substance. Amitriptyline hydrochloride. Brand name is Elavil. It's an antidepressant. It's not a controlled substance. Lorazepam. I included those 4 asterisks there. Name brand is Ativan. It's an anti-anxiety agent. It's a DEA Schedule 4 controlled substance. So notice that AM ending. That's kind of similar to clonazepam. Clonazepam, lorazepam. And later on you'll see as we go down the line there's another medication called temazepam. They all have that same ending again. So a lot of those similar drugs, you know, they will have the similar ending. So that can help you remember what it's used for. So again, it's DEA Schedule 4 controlled substance. Esomeprazole magnesium. I wonder what that OLE ending means. Brand name is Nexium. Probably familiar with that. Therapeutic class, gastric anti-secretory. So aha, there you go. That means it's acid reflux, not a controlled substance. And it is available over the counter, so you don't necessarily need a prescription anymore. It recently went over the counter. So ranitidine hydrochloride. Brand name is Zantac. It's a gastric anti-secretory. This one has a different ending because the drug is actually different in the way that its chemical structure is. So that's why. So you'll kind of have to pay more attention to this one on the test, potentially. So it's, you know, for that acid reflux. It is not a controlled substance. It's available over the counter. Duloxetine hydrochloride. Brand name is Cymbalta. It's an antidepressant. Now, I don't know if I even have to say this, but again, notice the ending here. Several of the other antidepressants have had that INE ending. It's not a controlled substance. So like fluoxetine, paroxetine is another one you'll see later on. So again, just notice those endings and pay attention to those, because that can really help you out on a test. Clonidine hydrochloride. Name brands are Catapress, Catapress TTS, or Nexalon XR. It's an antihypertensive. However, in my experience, I have seen this one used as like an ADHD medication for children. It's just not as severe as some of the like the Adderalls, as you'll find out. Learn about those later on. Those are C2 controlled substance levels. So it's just not as severe, I guess, of a drug. It's not a controlled substance, though. This one's my favorite one. Sulfamethoxazole with trimethoprim. It's just so fun to say. Name brands are Bactrim or Septra. It's an antibiotic, and look at that beginning. It's a sulfa. So that gives it away that it's a sulfa drug. So just pay attention to that, especially for your patients that have that sulfa allergy. It is not a controlled substance. Oxycodone with acetaminophen. I put 2 asterisks there. Brand names are Percocet, Roxacet, and Endocet. So those name brands, look at how they all end. They all end with that set ending. So that can kind of tell you what that can give it away on the test. Therapeutic class is an opioid analgesic, so it's for controlling pain. It is a controlled substance, DEA Schedule 2 medication. Divalproex sodium. Name brands are Depakote or Depakote ER. It's an anticonvulsant, antipsychotic. It's not a controlled substance. Insulin glargine, rDNA origin. Brand name is Lantus. It's an anti-diabetic because it is insulin, so there you go. And it is not a controlled substance.